Welcome to the 3-minute cardiovascular assessment video. We start by looking at some basic physiology. Now, the cardiovascular system essentially only delivers a cardiac output and a blood pressure. The cardiac output is important because this delivers nutrients to cells, which allows for cellular function. The blood pressure is formed when the cardiac output encounters vascular tone. The cardiac output is the product of a stroke volume and a heart rate. The stroke volume itself is dependent on preload, contractility and the afterload, partly itself due to the vascular tone. In assessing the CVS, the two things you'd really like to know about are the cardiac output and vascular tone. However, we have to make do with a number of other things that perhaps aren't giving us so much direct information about what the cardiovascular system is doing. Good, that's the physiology finished. Now we're on to the next part, assessing organ perfusion. Now, most people make the mistake that the place to start with cardiovascular assessment is the monitor. That's rubbish. Really, the things you want to find out about are the blood lactate and the capillary filling time. These are the only parameters that will tell you how well the cardiovascular system is doing its job. Squeeze for 5 seconds and then release, counting the number of seconds before the blood returns to the capillaries. Here's a patient who has impaired capillary filling due to poor cardiac output. Looking peripherally can be misleading. Looking centrally is more reliable, not affected by things such as fear, pain and a high temperature, as this patient's nurse is demonstrating. Now, you can also look at cardiac output by looking at the blood lactate. Anything over 2.5 implies that cells have insufficient oxygen. Urine output relates both to the glomerular filtration rate and also to the CVP. Urine can be measured hourly using a catheter or in less sick patients by weighing the nappies. Normal is in excess of 2 mL per kilo per hour. Now we're on to the next part, using vital signs to give you further information about the cardiovascular system. Blood pressure can be measured non-invasively, such as in this patient, or invasively. Having the right size cuff is essential. Doctors are obsessed about the blood pressure, and rightly so, because it's the blood pressure that drives blood to the organs. Maintenance of a good mean blood pressure is essential, but the diastolic can also give you useful information. If abnormally low, it implies the patient is vasodilated. The pulse can be measured peripherally or centrally. It tells you about the patient's cardiovascular response to whatever their illness is. However, many things other than impending shock can cause it to go up. Lastly, by feeling a central pulse, you can decide if the pulse feels either thready, normal or bounding. A thready pulse suggests a low stroke volume and a bounding pulse, vasodilation. You've finished. Now decide if your patient is decompensated or compensated and what the most likely cause of their problem is. That's the end of 3-minute cardiovascular assessment. We hope you found it useful.